Earlier this year, I was down in London and decided to spend a lovely afternoon at the Victoria and Albert Museum. Now, for those of you who haven't been there, let me just describe it as the most fascinating place on planet Earth, and which is essentially why I would encourage each and every one of you to actually go and visit. Now, this is not something where I'm just asking you to do something and you nod and then you forget about it after the talk is over, but I'm extremely serious about this. And you know how serious I am when I decided to dedicate an entire slide of my talk to directions and what it looks like. You've got no excuses now for not visiting. Now, if you're wondering why I'm blabbering about the V&A, well, it's simply because this time when I visited, I came across a very, very fascinating unit within the V&A, which is a new addition to it. And it's called the Rapid Response Collecting Unit. Essentially, what this does is that instead of the museum waiting for something to historically sort of gain significance, the museum looks around at the world and quickly adapts to all the changes around us. So what you will find at this part of the museum is a 3D printed gun that fired successfully. And that raises a lot of questions, political, social, design-wise, manufacturing-wise. Another thing that it houses is a virtual reality headset from the year 2014. It also has a refugee nation flag, which is a flag that represents all the stateless refugees that we have today. So when you go there, and which you will, when you go there, you'll see how much the world around us is changing, and it's changing so rapidly. And then things get existential. You start wondering, can I actually survive in this world? Do I need to change along with this changing world? Now, before you get too existential, the World Economic Forum has done your homework, and it says that these are the 3 key skills: complex problem solving, critical thinking, and creativity, that the workforce of tomorrow requires and needs to hone to be able to adapt to the kind of changes that we will see in the future. It could be artificial intelligence, it could be the problems that we face tomorrow. The World Economic Forum also, in another report, talks about the kind of problems we will continue to face. And you'll see that these are issues that we are still facing, and the prediction is that we will continue to face them. So in the most sort of reductionist sense of it, what it's telling you is that you use these skills and you try to solve those problems. And as simple as that is, you're wondering, how do I do that? Well, thankfully, I've got an answer. Me and my research partner, who's now at the London School of Economics, we decided to go and try it out. So we were working on a fantastic development program in India, and we were working on access to healthcare, which appears right there on the list. And the task at hand, the first one, was to work on increasing footfall of women who actually weren't coming for antenatal checkups during the 9-month course of their pregnancy. So these were 4 checkups during the 9-month course of the pregnancy, and they weren't showing up. So we went on field and we started working with the people it was affecting the most. And you might wonder that these were the women who weren't coming. But actually, the people who were more affected by this were the community health mobilizers. These are the women employed to bring the women to the health facility. And they were facing major issues. So we started working with them, and we started shadowing them. So we would work with them very closely. We would look at the kind of conversations they're having, the kind of paperwork, the kind of documentation that's taking place. And in the most reduced sense, what was happening was that if I were to assume, so if you, for example, were a pregnant lady, we asked you to come back on the 28th of April for a health checkup, And you, on the other hand, we asked you to come back on the 28th of March. Now, what was happening is simply you weren't coming back. You weren't turning up. And then these women would go knock on your door, ask you to come, practically drag you to come to the health facility for the checkup. Now, during the course of working with these women, we realized that you and the healthcare system were talking in two different languages. So what was happening was that when we asked you to come in April, you didn't understand what April meant. And March to you was just another word. We were working with a population that didn't understand the Gregorian calendar. Now, I don't want you to exotify this population. There are loads of people who are following very different, maybe far more advanced systems of time and ideas of time. And this was one such population. So we got back to the drawing board. We started working with these women. And I kid you not, after about 100 failed ideas, we came up with something. And that something happened to be the moon. What we started doing was, instead of asking you to come back in April, we simply asked you to come back after 2 cycles of the full moon. And you, on the other hand, we asked you to come back after 1 cycle. And you started coming back. And the footfall suddenly started increasing in the areas that we were working. Now here, the learning for us was that you need to ask the right questions. The problem here wasn't that we had like a lesser footfall and we had to increase it. The problem here was that the state and the beneficiary were talking in 2 different languages. And we had to bridge that gap. And again, we used certain creative skills, complex problem-solving skills, and came up with the idea of the moon. Now, after doing this, we were sent to another area, another district, to solve another problem. Now, I remember this was late in 2015, and we were driving down. It got rather late at night. And on the way, when we were entering the town, on either side of the road, we saw these little shacks, little stalls, rickety stalls, which I must say had the most innovative business plan ever. And the business plan was simple. They would download absolutely any movie for you on your mobile phone in 20 minutes, in HD, and that too at a nominal cost of 10 pence. What we were seeing over here was something massive that was happening in India at that time, which is India had suddenly crossed 1 billion mobile phone subscribers. And we were seeing that. We were seeing people utilize the mobile phone. There was a very interesting article in Forbes magazine which talked about how in places in rural India, the mobile phone is the new Swiss Army knife. It can do more than what the manufacturer thought that it could do. So now what happened is that the picture of the beneficiary changed. The end user that we were working with had a mobile phone and was using it every single night to watch a movie. So the task at hand over here was to, again, increase footfall. But when it came to vaccinating or immunizing little children, so we were dealing with little babies who were 0 to 2 years of age. I mean, that's how we define it. It just sounds weird when I say it. But 0 to 2 years of age, and they had to be vaccinated about 10 times during the course, the first 2 years of their life on Earth. Now, what was happening was the parents, again, weren't bringing their children. They were getting busy. They wouldn't forget. This wasn't really a priority. And again, the community health mobilizers had to be rushed to that door, knock, drag them back, vaccinate the children, keep a record, and so on. What we started doing was that we rolled out a little solution, which was called birth registrations through a missed call service. Now, the missed call service is another fascinating Swiss Army knife tool of the mobile phone. What it does is that if I were to communicate with you, and which is what a lot of beneficiaries would do, we would go for meetings, focus group discussions with them, and we would say, let's meet at 11 o'clock, right outside such and such a place. And the answer we would get is, sure, at 5 to 11, I'm going to give you a missed call, and you'll know that I'm standing outside and waiting for you. And that was fascinating. We were actually communicating without actually talking, without spending a penny. We were just giving each other missed calls, and we had entire conversations just based on that. So we leveraged that, and then we started using it for birth registration. So the idea was simple. Your kid is born today. You take out your phone. There's a centralized number, which is the government, and you give a missed call on that number. And that's it. What we at the back end do is that we get your phone number, we get the date that your child was born on, and now we basically run a basic algorithm that keeps calling you for various vaccines. So 3 weeks later, an automated phone call goes to you, and that says, well, it's time for the first vaccine. So you come back. A month later, it's time for the second vaccine. Another phone call goes, and so on. So we did this, and it worked. The learning here for us was that, watch out. The market is miraculous. It really penetrates faster than a lot of policies. And therefore, when you're designing policies, it's extremely important to be informed of what the market is doing, and maybe even piggyback on it. Now, with these two solutions in our bags, we went back to the government, to the head office, and we said, well, here's something that we've done. What do you think? Fairly impressed by what we had done, the government tasked us to do yet another thing. And this was, I mean, if I could put it mildly, the mother of all problems. The idea here was to innovate with bureaucrats. So what we would do is we would get into weekly meetings with them and get them to brainstorm. And really what the government wanted us to do was that this is all very well that you come on in and you solve certain problems, you come up with a solution, and then you move back out. But what we want is we want the system itself to innovate. Now, in the middle of all of that, we saw this sticker in a government building. And as you can read, it says, nothing changes if nothing changes. And this was the anchor point for us. We saw this, and we really didn't think about what it meant to anyone. We just knew that, okay, there was some spark here. There were certain people who really wanted to change. Somebody who was bold enough to take a printout of that and stick it on their door. And we just wanted to work with those few individuals and share our ideas and our processes of working with them. Now, as you can imagine, the government faces very different issues. These are not issues of people not coming in for vaccines and so on. Now we're working on hardcore problems, which were human resource management issues. Now, similar to earlier problems, what was happening was that in certain areas which were tagged as hard-to-reach areas, you had to, say, cross a river or climb a mountain, or certain villages where there wasn't proper road connectivity. So these existed, and these were tagged as hard-to-reach areas. And these were also places where a lot of healthcare cases would crop up every now and then. And one of the reasons that we sort of backtracked and the government realized was because proper inspections weren't happening here. People who were supposed to go for inspections, these were government officials, these were bureaucrats, policymakers, and policy implementers, who were supposed to go here on a weekly, monthly basis, weren't going. They were fudging their attendance. They would come back after doing whatever, sign saying, well, I went there, everything's fine. Well, it wasn't. So we got everyone into a room. We started working on a weekly basis, about 20 people working together, all bureaucrats, everyone extremely angry, shouting and screaming, very passionate about the kind of work that they're doing. And I remember this was a couple of weeks into the brainstorming sessions that we had. And we walked in very proud with certain ideas, and we were like, well, very excited about pitching our ideas to them. We walk in, and everyone's calm and silent and smiling. So naturally, we were wondering what happened. Well, they said the problem that we were working on We've solved it. We don't need any more solutions. It's done. It's solved. Now you can imagine how you feel when something like that happens. Where you walk in with a ton of ideas, extremely excited, and the person's like, well, we've solved it. So we said, well, why didn't you tell us what happened? What did you do? And they said, well, we used the selfie. And we couldn't understand what this meant. We had all of these complex data-based ideas and whatnot, biometric systems in place. So we said, well, we don't understand. Please care to elaborate a little more. And they said, it's very simple. All of us, the bureaucrats sitting in this room, are the people who go for inspections. We all have a decent internet connection on our phones, and we're all on this app called WhatsApp. And we share jokes, we do everything that you're not supposed to do on WhatsApp. And we said, sure, then what about it? They said it was simple. We just asked people who were supposed to go on inspections to go to the health facility in these hard-to-reach areas and click a selfie in front of the building with the clock visible that displays the date and time. And that's it. They just started doing their attendance rounds on WhatsApp using selfies. You can imagine how useless we felt afterwards. We had all of these ideas, and to be honest, they were garbage in front of a selfie that actually solved anything without any cost or effort. The learning for us over here was collaboration. You collaborate and share, and it only makes your job easier and faster and more efficient. The more you have, the more number of people working on a problem, the faster you're going to solve it. Now, the idea over here, and I must add, a more innovative bunch, if I could call them that, / lazy, they came up with an even better long-term based idea. They said it's all very well that we've solved it with a selfie, but the trouble is that we still have to go and do these checks. So they worked on like a 2-year vision on how not to go for this. And they said, well, we could employ virtual reality here. Plug in enough cameras there, have something moving around. I sit in my office, I plug into a virtual reality headset, and I do my entire round sitting in the comfort of my home or office. Now, these are the ideas that were coming from the government. And it was fascinating, it was extremely exciting to see that kind of optimism here. Now, again, the idea here is not to sort of watch change happen, to be a spectator and watch it all go by, but to actually be a part of it. If you remember, in the beginning, and I haven't forgotten, I asked you to go to the V&A. Let's amend that promise a little. I don't want you to go there and watch change displayed here and there as a passive observer. I want you to be that kind of change. I want us to create that vaccine that prevents HIV. I want us to create that vaccine that prevents TB. Create an app that reverses climate change. Create the kind of softwares that our refugee crisis could do with. Could virtual reality help with the refugee crisis? And by doing so, let's not go to the V&A. Let the V&A come to us and document the kind of innovations and ideas that we are presenting to the world and changing the world with it. Because the moment we start looking at problems as opportunities, let's face it, that's when we start solving them. Thank you.